Hi everyone, I'm Jeremy Saffron. Welcome to Press Reader Spotlight. Thousands of children were born with birth defects in Brazil, and that made cautious members of the public as well as health officials ask what is going on, and we found out it is about Zika virus. Joining us is the UBC Assistant Professor with Medicine, Jennifer Gardy. Dr. Jennifer Gardy.
Thank you.
Let's talk about Zika and what it is.
Let's talk about Zika. Zika is a virus. It's spread by mosquitoes and it causes an illness that we call Zika fever. And although Zika virus is related to some of the viruses that cause more serious disease, things like yellow fever, like dengue, Zika is actually a fairly mild illness. Really, most people that get Zika virus won't know that they're sick. If they do show symptoms, they tend to be quite mild. So we're talking, fever, rash, headache, conjunctivitis, pink eye. And it's one of those things that, although it seems new, most of our viewers probably only heard about Zika for the first time in the last couple of weeks. It's actually an old virus. We've known about it since 1947. It was discovered in equatorial Africa, and it's been causing cases in humans ever since.
So we're hearing about the Brazilians being obviously affected by this, but a lot of Central America as well as the Americas. Is there worry about North America?
There isn't worry about North America yet. And for that, it helps to know a little bit about how Zika spreads and how it's moved in the past. So this is a mosquito-borne virus. It needs a particular vector, we call it this mosquito, in order to spread disease. So you're only going to see Zika outbreaks where you find this mosquito vector. So we see it a lot in equatorial Africa. That's where Zika was first discovered in the 1940s. We see it a lot in Southeast Asia. That's where Zika next jumped to. Its next jump after that was about 8 or 9 years ago. It started showing up in Micronesia in the middle of the Pacific Ocean. Again, a place that's quite tropical. And now, as of 2015, you're seeing it in Central and South America. Again, equatorial, again, home to this mosquito vector. Now, if you look at North America, we've had a few cases, but they've all been imported. They were travelers that were going to Brazil, for example, and bringing the illness back. It wasn't spreading any further. And if you look at where that particular mosquito lives, in North America, it's only a tiny portion of the U.S., a little bit of the southern U.S. and a bit of the southeastern U.S., around Florida, for example. So if you don't have the vector, you're not going to have onward transmission. So we need to worry about importations, potentially a bit of person-to-person transmission, but not the type of large, sustained outbreak that you're seeing in Brazil.
We've seen a lot of officials warn about pregnant women to be on the lookout for not only mosquitoes, but some of the side effects. Why is it attacking pregnant women?
It's not that the disease is attacking pregnant women, it's that they're susceptible to an unusual complication that we're seeing for the very first time with Zika virus. We've seen Zika in the past. It's never been linked to anything more than this mild fever-like illness. But what Brazil started seeing, starting in 2015, was an increase in the number of Zika viruses, but at the same time, an increase in the number of microcephaly births. These are babies with very small heads. So there seemed to be a strong correlation between the increasing incidence of disease and this birth defect. That's not causation. We don't yet know for certain whether the virus actually causes this birth defect, but there's a good correlation there. So for that reason, CDC is recommending that women who are pregnant, if you do have travel plans that include a Zika-affected area, a place that's experiencing an outbreak, we recommend you postpone that travel. And if postponing that travel is impossible, the key is really protecting yourself from mosquito bites.
Right. And there's another thing that I want to get into, and that is the fact that when it comes to travel, people are saying that this could be sexually transmitted. Let's get into that a little bit. Is that what you're seeing?
Yeah, there's interesting evidence that this is, in fact, sexually transmitted. We've seen a couple of cases where partners, through semen, have infected their partners. So imagine you're a woman, you are pregnant, and you and your partner have planned a trip to Brazil, and you decide to postpone your travel plans, but your partner decides to go. It's important for them them to follow those precautions, things like wearing bug spray, ensuring you're sleeping in a room with screens and things. You don't want them to get infected and bring the virus back because it can transmit through semen. So pregnant women, if you are having sex throughout your pregnancy and your partner has been in an area where there's potential Zika virus exposure, wear a condom throughout the duration of your pregnancy because we know it can transmit through fluid like semen.
Now, in terms of, I mean, there's a lot of populations out there that aren't pregnant. So what are we seeing with those people? Do they see the side effects if they are in fact infected?
Yeah, it's a good question. People are asking, like, yeah, I'm trying to get pregnant, I'm thinking about getting pregnant. What does this mean for me? What does this mean for my travel plan? So if you're trying to get pregnant and you're thinking about traveling to a Zika infected area, the best advice is to have a frank conversation with your healthcare provider, talk about your travel plans, talk about your pregnancy plans, and see whether it's the right decision to go or not. There's no evidence that once a body has cleared a Zika virus infection, that it will have any effect at all on future pregnancies. There's no reason to believe that. The key is understanding how long it takes for the body to clear that infection. It looks like Zika can hang around for about a week in your blood after you start to feel better, but we don't know that for sure. Looks like it might hang out in semen a bit longer, but again, we don't know that for sure. So if I were somebody that were trying to get pregnant and were traveling to a Zika outbreak location, I'd probably put my pregnancy plans on hold for, I'd say, at least a month or two after I return.
So no concern with men then?
The men should be, again, following the same precautions. You don't want to be bringing this infection home to your partner because most people that get Zika don't even know they have it. Only about 1 in 5 people will actually develop symptoms. So it can be kind of a silent infection. And until we really know more about the link between the virus and between these birth defects that we're seeing, you know, is there a safe window in pregnancy? Is there a particularly dangerous period? Is there a link at all? Until we've answered those questions, really taking it safe is the best approach.
So in terms of symptoms, let's talk about it. A lot of people are unsure how they would feel or what to even look for if in fact they're infected. Yeah,
you might not even know that you have Zika virus. Most people that get it, in fact, don't ever show any symptoms. They have no idea that they're sick. It's only if they get a test long afterwards, they say, oh, wait a second, I've actually had this infection at some point in the past. Which is one of the reasons it's making it so difficult to link the birth defects to Zika virus infections. But if you are symptomatic, if you're the same 1 in 5 people that does actually start to feel sick, it's quite mild. There's typically a fever, there might be a conjunctivitis or pink eye. Oftentimes there's a small rash, it almost looks like a heat rash on your body. Those are the sorts of things to look for. But it's worth noting that if you are a pregnant woman who has traveled to an area where a Zika outbreak is happening, our current CDC guidelines suggest that you present yourself for testing when you come back, even if you don't feel sick. We really want to understand the link between Zika and potential birth defects. We want to know if you are a pregnant woman who has had a Zika infection. So even if you don't feel ill and you've been in an infected area, it's important to present yourself for testing.
So what are the officials and the governments themselves actually doing to control this potential epidemic?
Right now, there's a couple of approaches that we can take. First is pouring a lot of effort into vaccine discovery. Unfortunately, that process is slow. There is a vaccine candidate out there. It's probably going to be at least 18 months before we see it being trialed in people. So in the interim, our best strategy is fighting the mosquito itself. And this can be an individual effort or it can be a government effort. At the individual level, it's things like wearing bug spray, wearing sleeves, ensuring you're sleeping in a room that's screened or under a mosquito net. At the government level, it's implementing programs to reduce mosquito populations. So you can spray, for example, you can get rid of areas that mosquitoes love to grow in. They love stagnant water, ponds, things like that. So if you dry up those water sources, take away their breeding grounds, you can control the numbers. So at the moment, it's all about keeping the bugs at bay.
Now, there's been a lot of talk, and you can say that some officials are even doing and putting out a lot of warnings when it comes to the Zika outbreak. Is there more smoke than fire?
Well, it's an excellent question. The Zika virus itself isn't really a concern. It causes quite mild illness in most people that get it, even if they feel sick at all. But what is a concern, what is strange for us, what's new to us, is this link to microcephaly, this link to these birth defects. And we just don't have answers yet. So there's a lot of caution being advocated. There's a lot of guidelines that are coming out saying, okay, until we know better, let's take things easy. And I think that's correct. So there definitely is cause for concern. The WHO, World Health Organization, has declared this a public health emergency of international concern. Although it's important to note they're not referring to the virus itself,
right,
because that's not a concern for most people. They're referring to this potential link to the microcephaly birth defect. That being said, the public does, when there's a new virus, we tend to get concerned. We worry. That's our natural response. And I think it's important for us to remember, whether it's Zika, whether it's Ebola, we can't let ourselves be distracted by, the virus of the month. There are other things that are happening here to us now with very real consequences that we should be worrying about instead. Things like influenza, which kills thousands of North Americans a year. Things like measles, which is coming back. These are things that are more relevant to our daily lives. So I think the focus should be on keeping ourselves healthy, worrying about what's around us, and paying attention to things like Zika, but not letting them take over, not letting them become a panic virus.
Doctor, thank you so much for joining us.
Thank you, it was my pleasure.
Dr. Jennifer Gardy. To find out more about Zika, please go to her Press Freedom channel and support it. Thanks again, and see you next time.